How's it going, guys? Past level question for Immuno for step one. We've got a 61-year-old man with chronic venous insufficiency with a 12-hour history of confusion, 4-day history of worsening redness of his right leg that he has not sought treatment for. Vitals are temperature 102 Fahrenheit, heart rate 100, respiratory rate 16, blood pressure 90/50. Question wants to know which of the following cytokines is most saliently responsible for the patient's hypotension. You look at the image here, the chronic venous insufficiency is evidenced by the hyperpigmentation due to hemosiderin deposition. It's called stasis dermatitis or post-phlebitic syndrome. You can see it on both legs, notably the unaffected leg and the left leg in this case, because the right leg, the ruber, this is reflective of our cellulitis. Okay, so also two more. You can see that there's swelling of the right leg. So cellulitis is inflammation / infection of the hypodermis. It's usually pinkish in appearance, erythematous, in contrast to the fiery red or beefy red appearance of erysipelas, which is infection of the dermis. Looks worse than cellulitis, but cellulitis is actually worse because it's deeper. So normally we treat this with dicloxacillin, one of the methicillin class beta-lactams, or we can give a first-generation cephalosporin such as cephalexin or cefazolin. It's a long discussion. We could spend 12 minutes talking about all that stuff. But let's just hop through the answer choice here. Choice A, IL-1, wrong fucking answer. All you need to know for USMLE is that IL-1 causes fever. Okay, so if you get a question, there's sepsis / septic shock, and question just says which of the following is most likely responsible for the patient's fever. Answer is IL-1. In this case, wrong fucking answer. Choice B, IL-2, wrong fucking answer. All you need to know for USMLE is that IL-2 increases T cell response. Okay, there's a lot of drugs surrounding this. You could be aware that cyclosporin, tacrolimus, sirolimus, these drugs are going to decrease transcription / responsiveness of IL-2. It's a long discussion. You can be aware of daclizumab. It's a drug that blocks IL-2 receptor. Wrong fucking answer. Choice C, IL6, wrong fucking answer. Pretty much a non-existent cytokine for USMLE. So even though you'll learn this in med school, that IL6 increases acute phase protein production by the liver, there's obscure drugs out there like tocilizumab, holy shit, blocks IL6 receptor, could be used as a recondite medication in the treatment of rheumatoid arthritis. But in terms of actual NBME material, USMLE, and I reflect on the questions I've seen, IL6, basically non-existent. Garbage cytokine, wrong fucking answer. Choice D, IL12, wrong fucking answer. So you be aware that macrophages secrete IL12, which causes CD4 plus T cells to secrete IFN gamma, which in turn, that IFN gamma is going to stimulate more macrophages to secrete IL12, and round we go in a loop. I talk about this in my high yield Immuno PDF. It's not excruciatingly high yield. We have a pass-fail step one now, but in case you're wondering, I mean, okay, fine, IL-12, it stimulates T cells so that T cells can stimulate macrophages via IFN gamma. Wrong fucking answer. Choice E, IFN beta, interferon beta, wrong fucking answer. I've seen this assessed once. They can just write it as beta interferon. All you need to know for USMLE is that this is going to decrease recurrence of multiple sclerosis flares. So an acute flare of multiple sclerosis, we give IV corticosteroids, IV methylprednisolone, but between flares, we give beta interferon, and we can give baclofen for the treatment of spasticity. Okay, that's a GABA B receptor agonist. IFN beta, wrong fucking answer. Choice F, TNF-alpha, correct answer. So you need to know TNF-alpha is the salient cytokine that increases vascular permeability, causes vasodilation, decreases blood pressure and septic shock. It's really that simple, okay? So what they're going to do, they could just give you a cellulitis. They can give you any cause of sepsis, catheter, okay? And then you have hypotension and fever. And as I talked about before, IL-1 is the fever. They say which is responsible for the vascular permeability or responsible for the hypotension. Answer is TNF-alpha. There's a question on one of the NBME exams where they have combinations of cytokines. So each answer choice has two cytokines. They said which is responsible for this patient's presentation, who he had septic shock in the question, and the answer was TNF-alpha and IL-1. So you need to know those two cytokines for USMLE, exceedingly high yield. Correct answer. You know the deal. I'm going to make more content. If you like my stuff, subscribe my channel. Appreciate your time. That's it.